Hello, dear friends, and welcome. It's wonderful to have you with us today. Have you ever noticed a slight tremble in your hand when you reach for your morning cup of tea, or perhaps when you're trying to button a shirt? Maybe it's something you've seen in a loved one. It's easy to dismiss, isn't it? To think, oh, it's just a bit of age, or I'm just a little tired today. But what if that little tremor, that seemingly insignificant shake, is actually a whisper from your body, a clue to a larger health puzzle? Today we're going to embark on a journey together. We're going to explore what might be behind something as common as a hand tremor in our later years, specifically looking at the experiences one might encounter around the age of 80, though these insights are valuable for many of us. More than that, we'll be decoding some of the key health signals our bodies send us, signals that, if we learn to listen, can guide us towards a healthier, more vibrant life. So grab a comfortable seat, perhaps that cup of tea, and let's delve into these important health passwords together. I promise, by the end of our time, you'll feel more informed, more empowered, and perhaps a little more attuned to the incredible wisdom your body holds. Let's start by talking about that hand tremor. It can be quite unsettling, can't it? One moment your hand is steady, the next there's that involuntary quiver. It's important to understand that a hand tremor isn't a disease in itself, but rather a symptom, a sign that something else is going on. And there are quite a few reasons why this might happen. First, let's consider what we call physiological factors. These are often temporary and related to our body's immediate state. Have you ever noticed your hands shaking when you're incredibly nervous or excited? That's your sympathetic nervous system kicking into high gear. When you experience strong emotions, your body releases adrenaline, which can cause a very fine, rapid tremor. It's usually not something to worry excessively about and tends to subside as you calm down. Think about a time you had to give a speech, or perhaps when you received some surprising news. That fluttery feeling, sometimes accompanied by a tremor, is a classic example. Similarly, extreme fatigue can do it. If you've overexerted yourself, perhaps after a long day of gardening or looking after grandchildren, your muscles are tired. This exhaustion can manifest as a slight shakiness. It's your body saying, I need rest. Proper rest and allowing your body to recover usually resolves this. Even things like low blood sugar from skipping a meal or perhaps too much caffeine can temporarily cause your hands to tremble. Our bodies are finely tuned instruments, and these are often just signs that the balance is a little off. However, and this is where we need to pay a bit more attention, sometimes a hand tremor can be a signal of an underlying medical condition. This is why it's so crucial not to just dismiss it, especially if it's persistent or worsening. One of the conditions that often comes to mind when we talk about tremors in older adults is Parkinson's disease. Now, it's very important not to jump to conclusions, but it is something to be aware of. With Parkinson's, the tremor is often what's called a resting tremor. This means it's most noticeable when your hand is relaxed, perhaps resting in your lap, and it might lessen or disappear when you're actively using your hand. People sometimes describe it as a pill-rolling motion, as if they're rolling a small pill between their thumb and forefinger. Other accompanying signs of Parkinson's can include slowness of movement, stiffness in the limbs, and problems with balance or coordination. It's a progressive condition, meaning it tends to develop slowly over time. Then there's something called essential tremor. This is actually more common than Parkinson's-related tremors. Unlike the resting tremor of Parkinson's, an essential tremor is typically an action tremor. This means it's most apparent when you're trying to do something with your hands, like writing, drinking from a glass, or using utensils. It can affect both hands, and sometimes even the head or voice. While it can be frustrating and make daily tasks difficult, essential tremor doesn't usually cause the other health problems associated with Parkinson's, like the stiffness or balance issues. It can sometimes run in families, so if you have a relative with it, that might be a clue. Other medical conditions can also be culprits. For instance, an overactive thyroid gland, known as hyperthyroidism, can cause tremors. Think of your thyroid as your body's thermostat or engine. If it's working too fast, it can speed up your metabolism and lead to symptoms like a rapid heartbeat, weight loss, anxiety, and yes, tremors. A simple blood test can usually check your thyroid function. Low blood sugar, or hypoglycemia, especially in individuals with diabetes, can trigger shakiness. If your blood sugar drops too low, your body reacts, and tremors can be one of the first signs, along with sweating, confusion, and a feeling of weakness. Similarly, an imbalance in electrolytes like low calcium, hypocalcemia, can sometimes lead to muscle twitching or tremors. Our bodies need these minerals in precise amounts to function correctly. And let's not forget the impact of certain medications. Some drugs, including certain asthma medications, antidepressants, or even high doses of some common remedies, can have tremors as a side effect. That's why it's always so important to discuss any new symptoms with your doctor, who can review your medications. Finally, our lifestyle choices can also play a significant role. We touched on caffeine, but excessive alcohol consumption or alcohol withdrawal can definitely cause tremors. Over time, heavy drinking can damage the nervous system. A lack of regular physical activity leading to muscle weakness might not directly cause tremors, but can make you feel less steady and coordinated, perhaps exacerbating a very mild underlying tremor. So you see, a hand tremor can be a complex sign with many potential origins, ranging from the temporary and benign to indications of a more significant underlying issue. The key is observation and not being afraid to seek clarity. Now, while a hand tremor can be a very visible clue, our bodies often send us other, sometimes more subtle signals that it's time to pay attention to our health. Let's explore some of these other critical health passwords. Think about changes in your physical well-being. For example, are you experiencing more frequent falls? Sometimes we might attribute a fall to simply being clumsy or tripping over something. But if falls are becoming a regular occurrence, it could indicate problems with balance, muscle weakness, issues with your vision or inner ear, or even neurological conditions. Each fall carries a risk of injury, so it's a signal that warrants investigation. What about your sleep patterns? Profound changes in sleep, like persistent insomnia, waking up frequently, or excessive daytime sleepiness, can be more than just annoying. Sleep is when our body repairs and rejuvenates. Chronic sleep disturbances can impact your mood, your energy levels, your cognitive function, and even your immune system. Sometimes it's related to stress or anxiety, but it can also be linked to conditions like sleep apnea, restless leg syndrome, or pain. Then there's the gradual decline in vision or hearing. Is the text in your favorite book becoming harder to read, even with glasses? Do you find yourself asking people to repeat themselves more often, or turning up the television volume? These sensory changes are common as we age, but they can significantly impact our quality of life and safety. Regular eye and hearing checkups are vital, not just for new prescriptions, but also to screen for conditions like cataracts, glaucoma, macular degeneration, or hearing loss that might benefit from aids or other interventions. And let's not overlook oral health. Problems in your mouth like persistent dry mouth, bleeding gums, loose teeth, or sores that don't heal can be signs of local issues like gum disease or infection, but sometimes they can also reflect systemic problems, including diabetes or nutritional deficiencies. Good oral hygiene and regular dental visits are more important than you might think for overall health. Beyond these daily physical changes, we also need to be mindful of the potential threat from chronic diseases, many of which can be quite stealthy in their early stages. High blood pressure, often called the silent killer, is a perfect example. You might feel perfectly fine, yet your blood pressure could be consistently elevated, putting a strain on your heart, blood vessels, and kidneys. Without regular checks, it can go unnoticed until serious complications arise, like a heart attack or stroke. That's why having your blood pressure checked regularly, either at home if you have a monitor, or at your doctor's office, or even some pharmacies, is so crucial. Diabetes, particularly type 2 diabetes, is another common chronic condition in older adults. Early symptoms can be subtle, perhaps increased thirst, frequent urination, unexplained fatigue, or blurred vision. Sometimes there are no noticeable symptoms at all in the early stages. Regular blood sugar screening, especially if you have risk factors like a family history or are overweight, can help catch it early, allowing for management through lifestyle changes and, if necessary, medication to prevent long-term complications affecting your eyes, nerves, kidneys, and heart. Cardiovascular diseases, which encompass conditions affecting the heart and blood vessels, remain a leading health concern. Symptoms like chest pain or discomfort, angina, shortness of breath, palpitations, or unexplained swelling in the legs can all be warning signs. But again, sometimes the early stages are silent. Maintaining a heart-healthy lifestyle and undergoing regular checkups that might include cholesterol tests and an EKG can help assess your risk and guide preventative measures. The message here is clear. Regular medical checkups are not just for when you're sick. They are a cornerstone of proactive health management, especially for these chronic conditions. And we mustn't forget the invisible yet incredibly powerful aspect of our well-being, our mental and psychological health. This is just as important as our physical health, and often the two are deeply intertwined. Anxiety is a common experience, but when worry and fear become overwhelming, persistent, and interfere with daily life, it might be an anxiety disorder. In older adults, anxiety can manifest as restlessness, irritability, difficulty concentrating, muscle tension, or sleep problems. It might be triggered by health concerns, loss, loneliness, or major life changes. Depression, too, is more than just feeling blue. It's a persistent sadness, a loss of interest or pleasure in activities you once enjoyed, changes in appetite or sleep, fatigue, and feelings of worthlessness or hopelessness. Sometimes in older adults, depression can be mistaken for other medical conditions, or even just a natural part of aging, but it isn't. It's a treatable condition, and acknowledging it is the first step. Cognitive changes are also a significant concern as we age. We all have moments of forgetfulness. Where did I put my keys? What was that person's name? But when memory loss becomes more significant, affecting daily tasks, or when there are noticeable changes in thinking, problem-solving, or language skills, it's important to seek an evaluation. Early signs of cognitive impairment or dementia, such as Alzheimer's disease, can be subtle. Perhaps it's increased difficulty managing finances, getting lost in familiar places, or changes in personality. Ignoring these signs won't make them go away, but early diagnosis can lead to support, resources, and sometimes treatments that can help manage symptoms and improve quality of life. The common thread through all these mental and psychological challenges is that they are real, they are impactful, and they are not something to be ashamed of or to face alone. Reaching out for support, whether from family, friends, or healthcare professionals, is a sign of strength. So we've talked about hand tremors, other physical signs, chronic diseases, and mental well-being. It might seem like a lot to keep track of, perhaps even a little overwhelming. But the intention here isn't to cause alarm, far from it. It's to empower you with knowledge. Because when you understand these potential health clues, you're better equipped to take proactive steps. And that leads us to the most important part. What can we actually do? Let's talk about our action guide. First and foremost, if you notice a persistent hand tremor or any of the other health abnormalities we've discussed, the most crucial step is timely medical action. Please don't try to self-diagnose by searching symptoms online, and don't just hope it will go away on its own. Schedule an appointment with your doctor. They are your best ally in navigating these concerns. When you go for your appointment, be prepared to provide as much information as possible. For example, if it's a tremor, when did you first notice it? Does it happen at rest or during activity? Does anything make it better or worse? Are there any other symptoms you're experiencing, even if they seem unrelated? Make a list of all your medications, including over-the-counter drugs and supplements, as well as any existing medical conditions. The more information your doctor has, the better they can assess your situation. They might conduct a physical examination, ask more questions, and perhaps recommend further tests, like blood work or imaging scans, to get to the root of the problem. Remember, early diagnosis and intervention often lead to better outcomes. Next, let's talk about optimizing your lifestyle. This is where you have a tremendous amount of power. Many of the health challenges we face can be positively influenced by the choices we make every day. Think about your diet. Aim for a balanced and nutritious eating plan. This generally means plenty of fruits, vegetables, whole grains, and lean proteins. Try to limit processed foods, sugary drinks, and excessive salt and unhealthy fats. If you have specific conditions like high blood pressure or diabetes, your doctor or a dietitian can help you tailor a diet that meets your needs. For instance, a low-salt diet is often recommended for managing hypertension. Ensuring you get enough calcium and vitamin D is important for bone health, which can reduce fall risk. Staying well hydrated by drinking enough water throughout the day is also fundamental. Then there's physical activity. Movement is truly medicine, especially as we age. You don't need to run marathons. Gentle, regular exercise can make a world of difference. Consider activities like walking, swimming, tai chi, or gentle yoga. These can help improve strength, balance, flexibility, and cardiovascular health. Aim for at least 30 minutes of moderate intensity activity most days of the week, but always listen to your body and choose activities you enjoy and that are safe for you. If you're unsure where to start, talk to your doctor or a physical therapist. Even small amounts of activity, like taking short walks or doing simple chair exercises, are beneficial. Quitting smoking and limiting alcohol are also powerful lifestyle changes. If you smoke, it's never too late to quit. Your body starts to repair itself almost immediately. And when it comes to alcohol, moderation is key. Excessive alcohol can contribute to a host of health problems, including some we've discussed. And of course, prioritize good sleep hygiene. Try to maintain a regular sleep schedule, create a restful environment in your bedroom, dark, quiet and cool, and avoid caffeine and heavy meals close to bedtime. If sleep problems persist, discuss them with your doctor. Finally, let's talk about the importance of regular health guardianship. This means proactive, ongoing attention to your well-being. Regular checkups with your doctor, even when you feel fine, are essential. These visits allow for routine screenings, vaccinations, and an opportunity to discuss any subtle changes or concerns you might have. How often you need a checkup can vary based on your age and health status, so ask your doctor for their recommendation. These appointments are also a good time to review your medications and ensure they are still appropriate and effective. Beyond doctor's visits, self-monitoring can be very empowering. If you have high blood pressure, your doctor might recommend monitoring it at home. If you have diabetes, regular blood sugar checks are vital. Keeping track of these numbers can help you and your doctor manage your condition more effectively. Pay attention to how you feel day to day. Keep a simple health journal if it helps you track symptoms, energy levels, or any changes you notice. This can provide valuable information during your medical appointments. Remember these health clues, these passwords we've been discussing: the tremor in your hand, the stumble on the stairs, the persistent fatigue, the lingering sadness. They are not signs of failure or weakness. They are simply communications from your wonderfully complex body. Learning to listen to these signals and to act on them with courage and wisdom is one of the greatest gifts you can give yourself. As we draw our conversation to a close today, I hope you feel more equipped and less anxious about navigating the health journey of our later years. It's true that as we age, our bodies change, and we may encounter new health challenges. But it's also true that we have incredible resilience and a wealth of resources available to us. The key is to be an active participant in your own health. Don't ignore those subtle whispers or even the louder calls from your body. A hand tremor might just be a temporary response to stress, or it could be an early signpost pointing towards a condition that needs attention. The crucial thing is not to guess, but to find out. So I encourage you, dear friends, to embrace this knowledge, not with fear, but with a sense of empowerment. Pay attention to your body, value those regular checkups, nurture yourself with good food, joyful movement, and restful sleep. And please, never hesitate to reach out to your healthcare providers when you have questions or concerns. They are there to partner with you. Your health is your most precious asset. By understanding these health passwords, by being observant and proactive, you are taking powerful steps to protect and enhance it, allowing you to live your life with more joy, more vitality, and more peace of mind. Thank you for joining me today. Take good care of yourselves and remember, you are not alone on this journey.